Hello, today's video is about diabetes. I saw 4 patients the other day, one with a sugar of 380, another with a sugar of 427, another with a sugar of 505, and another with sugar of 710. Oh my God. And these people had minimal symptoms. The problem is that your diabetes is not controlled. You can have sudden onset of chest pain, breathing problems, blindness, stroke. So even though you feel okay, you're not too debilitated, you can have a sudden complication. In general, the dangerous levels of sugar is more than 300, and then super dangerous is more than 400. I've seen many times patients who are more than 400 have to go to the emergency room. They have a heart attack or a stroke, or they have dehydration, or they have infection in the bloodstream, because when the sugar is more than 400, your immune system does not work at all. Your immune system is dysfunctional. It doesn't fight off bacteria well. It doesn't heal your skin well. It doesn't tell you what's going on with your pancreas and brain and heart. Just because you feel well doesn't mean you don't need to have a diabetes check. I recommend that you have a diabetes check once a year if you have no symptoms and you've never had high sugar. Once you have high sugar, you should have your diabetes checked 3 times a year. If you don't want to go to the doctor, you can buy the glucose machine called a glucometer on Amazon, and the little strips that go inside the glucose machine, and the little pokers for your finger. So this is a way you can monitor yourself. Only costs $25, so it's really cheap to buy it on Amazon. The types of diabetes are type 1 and 2. Type 1 is you get it as a young age, usually 18 to 25 years old. And then type 2 is several classes. The way I classify it for persons who aren't doctors is mild symptoms or no symptoms, diabetes type 2, or medium symptoms like numbness of the legs, pain of the legs, lack of focus, dizziness. And then you have severe symptoms, chest pain, breathing problems, going to the hospital, severe acid in your bloodstream, infection in your bloodstream, sores on your feet, and even amputations and blindness. That's the severe type. Some are insulin resistant, some are immune based, some are diet related, some are stress related, of these 3 types of diabetes. Here's a glucometer, and then you have the strips. You have the strips. You clean yourself off. You clean your finger. You put the strip in the machine. Like that. Put the strip in the machine. And then you have a poker. Different pokers, different ways. This one you take off the tip and then you poke yourself in the finger. Squeeze the blood coming out, and then you touch the machine to the glucose machine. This next patient has a sugar of 710. by I don't know what miracle, he has minimal symptoms, just a little foggy brain, a little weakness, sleeping a lot, peeing a lot. The very important thing in him is that he has a kidney transplant. So he's very liable to hurt the kidney transplant that he had, and then he has to go back on dialysis. I explained this to him so many times, but he says that he's trying to take his medicine, but he always has an excuse. He can't afford it. Insurance didn't pay. He forgot to take it. And his diet is a high carbohydrate diet. I've tried to tell him, you know, high protein, high vegetables, low carbohydrate diet. He had the kidney transplant about 10 years ago. He has a below the knee amputation on the right. And now he has infection of his left foot. He has a deformity of his foot because diabetes neuropathy can cause deformity of the bones. And so when he walks, there's a lot of pressure at the ball of his foot because of the abnormal bones. His blood tests show no acid in the blood, no infection in the blood, so that's good. He is on IV antibiotics through a needle in the arm, that arm, and then it's connected to a pump at his belt, and that pumps the IV antibiotics into his bloodstream. He's seen the infectious disease doctor. He's been on this now for about 6 weeks. I suspect he'll be on it for another 6 weeks. All I can do is I'm going to see him in 2 weeks to try to encourage compliance. The next patient is sugar 505. And luckily, he doesn't have any kidney problems. He has a below the knee amputation on the right, and he has all his toes removed on the left. He had an infection a year ago. He was on antibiotics IV for 9 months. Same thing. He had a tube right here in the arm, and then connect to a battery on his belt. He was taking his medicine last time, and his sugar was in the 200 range, but today the sugar is 505. I'm going to refer him to the endocrinologist, and he's going to see the infectious disease doctor and the foot doctor, and hopefully this infection gets better and doesn't get worse. Hopefully he doesn't get acid in his blood or infection in his blood. He's high risk with a sugar of 505, high risk for diabetic ketoacidosis and more neuropathy, gangrene of the other toes, and an inability to heal the infection. So cross our fingers, hope he does well. Okay, more stories about patients with diabetes. This patient had a glucose of 427. For over 400 is the dangerous range. He had a foot infection, and he had neuropathy. The nerves of his legs weren't working properly. He couldn't feel his toes, can't feel below the knee. And because of this neuropathy, because of the nerve dysfunction, his foot became deformed. First of all, he lost his arch. He doesn't have an arch. It's flat. Second of all, the toes are overlapping, and the big toe is kind of crunched and deformed, in the foot. So what happens when he walks, the deformed toes are hitting the floor, with the shoe. The shoe doesn't fit properly, and the toes are hitting improperly, the flat, no arch, and he got an infection under his big toe. He doesn't take his medicines all the time. He says he feels good, no symptoms, vomiting, chest pain, shortness of breath. And I keep trying to remind him, even though he feels good, he needs to take his medicine. He's been seeing the foot doctor for the foot infection. So far, his kidneys, heart, and his brain are okay. And so I try to emphasize him, even though you feel good, you need to take your medicine. Your goal is your sugar to be below 120. Now, the next patient is a sugar of 380. This patient, he ran out of medicine. He's a young guy. He's like 40 years old. He says he ran out of medicine because he couldn't afford it. But I think that he feels pretty good and he's trying to ignore, trying to deny that he has diabetes so he doesn't go to pick it up. Even though he can't afford the medicine, he wants this very expensive injection shot, Ozempic. And I tell him his insurance won't pay for it. No, and they says, yes, my insurance will pay. And so I go through the pre-authorization process and insurance doesn't pay, but he's upset that he's not getting this expensive medicine that all his friends, his diabetic friends are taking. And he's not focusing on the basic problem, is to lower your sugar. Doesn't matter if it's expensive medicine or cheap medicine. There's a lot of cheap medicines to give, metformin, glipizide. And, you can spend, $50 a month on medicine and to control your diabetes. Now you can control your diabetes, go from 380 to 0 without medicine. I had a patient that was on 3 diabetes medicine, 3 blood pressure medicine. He got COVID, so he stopped eating. And then sugar came to normal. The blood pressure came to normal. And then he got over COVID, started eating everything, lack of exercise, and the blood pressure went up. We had to restart the 3 diabetes medicine and restart the blood pressure medicine. You can cure your diabetes with diet, exercise, and lowering stress.